Hi everyone, welcome back to PharmaExplora. Today we are going to discuss another route of drug administration, that is nasal inhalation route of drug administration. When we're discussing about nasal inhalation route, this pathway serves dual purpose. In one hand, it acts as highly localized shield for seasonal allergies, and simultaneously it acts as a genius systemic backdoor to delicate, fragile medicines, allowing them to enter directly into the systemic circulation without involving painful needles. So without further ado, let's start today's discussion about this interesting nasal inhalation route of drug administration. First of all, let's discuss what is nasal inhalation route of drug administration. When we're talking about this nasal inhalation route of drug administration, what comes to your mind? What do you understand by this term nasal inhalation route? In very simple terms, we can explain the nasal inhalation route of drug administration as administering the drug or the medicine directly into your nose to inhale. So, administering the drugs or the medicine directly into your nose to inhale is the nasal inhalation route. So, here, if this is a medicine, you administer this drug directly into your nose. Similar to the lungs, this nasal cavity is also a beautifully engineered absorption zone. Now we are going to discuss how. Here I have drawn a diagram of nose and nasal cavity. So this is our nose. This is our nose. And this is our nasal cavity. This is the nasal cavity. So, nasal inhalation involves administering the medicine directly into the nasal cavity. Now here, this nasal cavity is lined with highly vascularized, the moisture-rich mucous membrane. This nasal cavity is lined with highly vascularized, moisture-rich mucous membrane. So this blue color lining is highly vascularized, moisture-rich, mucous membrane. Just beneath the surface of this lining, you will find highly packed tiny blood capillaries, a lot of tiny blood capillaries. Just beneath the surface of this lining, you will find highly packed tiny blood capillaries. Those are blood capillaries. So now you can see, once you administer medicine to nasal cavity, those drug molecules can cross through this lining and enter into the blood capillaries, ultimately into the systemic circulation. Therefore, this nasal cavity provides fast and direct access to systemic circulation. Fast as well as direct access to systemic circulation. Without involving a single painful needle. Based on the drug formulation or the chemical design of the drug molecule, we can either expect the localized effect, which is limited to the nasal cavity, or as well as we can expect systemic absorption and the drug molecule to travel throughout our body. So, depending on the chemical formulation, the drugs which administer through nasal cavity can achieve either the localized effect or systemic uh, systemic circulation. The most important clinical advantage of this nasal inhalation route of drug administration is its ability to deliver certain fragile, complex molecules, drug molecules, directly into the systemic circulation, completely bypassing this gastrointestinal tract. So, the most important clinical advantage of this route is its ability to deliver fragile, complex, fragile, complex drug molecules directly into the systemic circulation, completely bypassing our gastrointestinal tract. I hope you remember in our oral route of drug administration, we discussed the disadvantage of gastrointestinal tract when we administering medicine through orally. So there we identified stomach and the liver as the strict checkpoints. So here the stomach and liver. Those are the places that drug molecules get destroyed. So if you swallow a delicate peptide or a fragile, very sensitive drug molecule, what will happen? First, it will go to the stomach and digestive enzymes in the stomach. The digestive enzymes in the stomach, this is our stomach. So, the digestive enzymes in the stomach, once our drug molecule goes to the stomach, what will happen? The digestive enzymes in our stomach will destroy our drug molecule. Oh, if it goes to the liver will destroy this delicate medicine. Therefore, the advantage of using this nasal cavity is once you administer the drug molecule into the nasal cavity, it will cross through this mucous membrane and absorb into the blood capillaries and enter into the systemic circulation, completely bypassing the gastrointestinal tract. So this drug molecule will achieve the systemic circulation, preserving its original form. Now we are coming to the most interesting part of our discussion. We are going to discuss about the real-world examples of nasal inhalation route of drug administration. Our first example is oxymetazoline. Oxymetazoline is a powerful nasal decongestant. So this is the ultimate relief for completely stuffed up nose. So what happened in a stuffed up nose is, you can see within the nasal cavity, these blood vessels have swollen. Due to the swollen blood vessels, the space within the nasal cavity is narrowed. Because of this narrow space in the nasal cavity, you cannot breathe easily. Therefore, once we administer this oxymetazoline intranasally, what will happen into the nasal cavity? These drug molecules goes into the nasal cavity and landed on the swollen blood vessels and make these swollen blood vessels to constrict. Once these blood vessels constrict, the nasal cavity, the space between the nasal cavity is cleared, and so that you can easily breathe again. Therefore, this oxymetazoline, our first example, is a powerful nasal decongestant which we use to obtain the localized effect of this nasal pathway. Now we are coming to our second example, Mometasone Furoate. Mometasone Furoate is a powerful anti-inflammatory intranasal spray, most importantly, which is a corticosteroid. Now, this medicine we use to treat condition called allergic rhinitis, and also we call this hay fever. This is an inflammatory response caused within the nasal passages due to or the triggered by airborne allergens. Triggered by airborne allergens. Once you inhale those airborne allergens, those go into your nasal cavity and your immune system overreacts to that. It will release the histamine and it will generate conditions like itching, then rhinorrhea, then the nasal congestion as well as sneezing. So this rhinorrhea is a medical term we use to explain runny nose, which our nasal passages provide very watery thin mucus mucus due to this condition. So, when we applying this Mometasone Furoate intranasally, this medicine go into your nasal cavity and reduce the sneezing, nasal congestion, rhinorrhea as well as itching. Therefore, you can see while applying this Mometasone Furoate intranasally, we limit the action of this medicine locally into the within the nasal cavity without exposing or the powerful corticosteroid into our entire body. So this is another good example how we use this intranasal route to achieve localized effect. Now we are coming to our third example, Desmopressin. Desmopressin is a peptide hormone. This medicine shows the nasal inhalation routes true engineering brilliance by treating a major disorder deep within our body. Now let's discuss how. The desmopressin is a peptide hormone which we use to treat a disease called diabetes insipidus. This diabetes insipidus is a rare but severe disorder where the body cannot balance its fluid. So this disorder causes unquenchable thirst as well as it forces kidneys to produce large amount of dilute urine. Now we know this desmopressin is a peptide hormone, a delicate peptide hormone. So what will happen if we take this medicine orally? It will travel through our gastrointestinal tract and reaches to the stomach, and the digestive enzymes in the stomach will destroy it even before it reaches to the bloodstream. Now This desmopressin is a peptide hormone. Peptide hormone. So if we take this medicine orally, what will happen? It will travel through our gastrointestinal tract and reaches to this is our stomach, let's assume. Now, if we swallow this medicine, this will travel through our gastrointestinal tract and reaches to the stomach, and digestive enzymes in the stomach will destroy this delicate peptide hormone. Therefore, pharmaceutical scientists have developed this medicine as an intranasal spray. So now what we do is we apply desmopressin intranasally. So this drug molecule enter into the nasal cavity and cross the mucous membrane and enter into the tiny blood capillaries. By entering to the tiny blood capillaries, eventually they reach into the systemic circulation. And once this drug molecule goes into the systemic circulation, it travels throughout our body and reaches to the kidneys. And once it reaches to the kidneys, it will regulate the water retention and prevent the patient from dehydration. So that is how the intranasally applied the desmopressin treating the major disorder deep within our body. So this is a good example to show how this nasal inhalation route achieves systemic absorption. To wrap up, today we discussed about nasal inhalation route of drug administration. There we discussed what is nasal inhalation route of drug administration, the mechanism behind it, advantages as well as real world examples. I hope you have learned something from this video. If you find this video helpful, just hit the like button and subscribe PharmaExplora channel. And also, if you want to see our previous videos about the routes of drug administration, I have put down the links below so you can go through those videos as well. Thank you very much for joining with PharmaExplora today and see you soon.